Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Welcome back to the program. This is Aebhric. Today, I am with Patrick Wenger. Patrick, you are on the Air Zermatt. You are also a remote medic on a ship, and you're currently in La Spezia, Italy. So, Patrick, welcome to the program.
Hello, Aebhric. Thank you for inviting me to this podcast.
It's good to talk to you. We've met 2 years ago at Air Zermatt, and I ran into you in the Royal College of Surgeons of Edinburgh randomly about a year ago, and I keep going back to your conference in Air Zermatt for any excuse to go back to Zermatt is a good excuse, but you are now on our faculty, so you teach austere emergency care. You taught on courses in Malta, and I wanted to give our audience the chance to meet you and see what you're like. So welcome to the program.
Thanks a lot. I really appreciate to be a part of the program and really feel honored. And I think we're coming back later to this point. For me, it's a huge step up to join your faculty. Actually, it's open up a new world for me as well. And now I'm the right setting at the moment on the boat.
So you are benefiting the college as well, Patrick. So tell us about yourself. Tell us about your background.
Yes, good question. Who I am. My name is Patrick. All places I go, they find a different name for me. So Pat, whatever is related to my name, you can call me. I turned 40 years last month, so halfway or whatever. However, it's still ahead of me. From my medical perspective, I started 2005 as a ski patrol, so basic. I became a ski patrol pretty fast, spent since 2005 almost all the time in the mountains or other nice places around the world. So after I stopped to being a ski patrol, I was able to join Air Zermatt and did my paramedic trainee program for 3 years. In these 3 years, I learned a lot more, of course. Shortly after I finished my degree, I started to teach the courses from the Air Zermatt Training Center, teach those courses for a long period. Finally, we met each other in Zermatt, that's right. It's really hard to don't run in you. You're a big guy, so Zermatt is small. Really happy I did that. Now I be a part of your faculty.
It's kind of a no-brainer to bring you on, Patrick, because you have shown excellence in everything that you've been on so far. And I'm delighted that you are now sharing your excellence with our faculty and with our student body. So we met at Air Zermatt 2.5 years ago at the conference. So tell us about the Big Sick conference every February at Air Zermatt.
Yeah, Air Zermatt and the Big Sick conference are separately run. The idea for the Big Sick, TBS, the sickest patient in the first hours, came somewhere in a mountain hut between some, I think, after a course in the evening. Everybody was exhausted, mostly hypoxic. So they thought, hey, let's do a conference. Zermatt looks nice, has the Matterhorn. A lot of people find the last village in this valley. So let's start up a conference. It was about a long time ago. Finally, 2015, it was the first edition of the Big Sick, and now on 2024, we're on the 6th edition of this conference.
And it's a super small conference. You only allow 85 people to attend.
Yes, 85 was our beginning. Now, last year we had a little bit more. We had so much interesting in our conference that we had, okay, let's try more. So we run up to 100, 110 at the sponsors, at the speakers. So we were a little bit more. But the biggest feedback always was, hey, the vibe during this conference, it's because it's so small. It's a special to be there as a guest, a speaker, even for me, super special for me as an organizer. I'm really appreciate also that all the work is done with Daniel, Mats, Anders, and of course Oliver, whatever runs behind the scenes. So we have to do a triage somehow. Not the best in doing triage without pressure. So we have the triage who can join and who can maybe join the next year. It's really hard for us to decide, but I mean the world on the top of the pyramid is pretty small, and normally we get some feedbacks from all over the world.
Mm.
We also want to have a good mix between people that makes the decision and future people that going to make the decision in a couple of years.
It's always really high quality people that I see on the Big Sick conference, and I learn every time I'm there. It's fascinating sitting in the back of the classroom and watch these presenters who are cutting edge in all over the world. It's not just a European thing. It's from everywhere. Now that Oliver is a fully qualified PJ from the U.S. Air Force, I imagine we're going to have a bit more U.S. influence.
Yeah, for us it's really important that we have the west from the other side of the oceans to the another side of the oceans that are really the biggest speakers around the whole world that are coming. We had the influence already before, some from the States.
So, Patrick, if someone wants to come to the Big Sick, how do they find information about it?
There's a website, TBS24. You will find it. For everybody that cannot join Zermatt in February next year, we also have it on foam. So you can, all the speakers, all the lessons you can watch online and live.
For free. I was really impressed with that. That you can. It's on YouTube, I think, that you can watch live.
Yes, true. You can watch it live and for free.
So, Patrick, you're part of Air Zermatt. Tell us about work on Air Zermatt. What does that look like? What is it you do, and how many calls do you have, and what types of people do you see?
Also, for Air Zermatt is a company that's grown up made by a local pharmacist, 1968. So he bought a helicopter, and since then they did a couple thousand of rescues. Learned a lot during this. Yeah, I mean it was the first mountain rescue so far done with helicopters in this kind of setting in the area. Now we have 2023, 55 years later, right? Even more lessons learned. We're running a lot of calls during the high seasons, like summertime, wintertime. It's completely different if you run call, as it's not completely different, but the calls are different from summer to wintertime. We have a lot of international guests, so it's really interesting to work with having patients from China, from whatever country they're coming from. A lot of communication. Then we from Zermatt up to the Little Matterhorn. You are really fast. It takes about 50 minutes, 1 hour from 1,600 meters above sea level to 3,880. So the highest point that you can
Wow,
reach. It's a really nice place and office for me to work 24/7. You're always welcome to show up. You can come to base, take a look, ask if there's some paramedic or whoever is on the base to show you around, and or send an email ahead. Then you can organize something if you're interested into. For specific calls, it's really hard to make a decision, but it's about 70 to 80% is trauma related, especially in the wintertime, mostly ski accident.
mm,
It's cold. Sometimes it's super cold. Fractured legs and whatever you can get on the ski slopes. A lot of villages are only accessible by helicopter in the wintertime as well. Depends to avalanche conditions or risk. You have a huge spectrum: crevasse, avalanche. We have a pretty nice area for driving motorbike, like I do by myself. So you could get all the calls that you normally have as well.
nice.
Yeah, that's basically it. We have 24-hour shifts normally, according to the laws of the EASA. Starting your duty, check your equipment, have a chat and talk with the pilot, with the other crew members, supporting the flight assistants in their work whenever they need us, when we don't have a call.
So, how do you manage acute mountain sickness if you are having that drastic of a elevation change? Do you have AMS, or is it so quick that you never have to deal with HACE, and AMS?
I think the big years in Zermatt for AMS was late 80s, 90s. They did a lot of studies in the Gavanna di Margherita, Monte Rosa hut. And there it was really regular calls to fly haze down from there, other mountains as well. Now, I think the prevention got much, much better than in the past. So we have less calls for these topics, and especially when you are so super fast with the helicopter. The best treatment is flying them down to the hospital. Mostly they're already better, but we still have some, but it's a really low percentage of it.
And you as a paramedic, when you go up to that height so quickly, do you feel the symptoms of the altitude, or is that not? Are you acclimated, or how does that work?
Aebhric, that's a good question. I was really into it. Specific, I really had the chance also to have a rotation based work with Air Zermatt. I did 2 months desert, back 2 months for Air Zermatt. So jumping straight from the desert hot environment to the cold environment, and mostly high environment. So I had the impression for me that I have to train it before. I cannot go from plus something and minus something. So I really was looking into specific training for myself to get acclimated before I go up to the altitude.
That's a good point. If you're working on the boat now,
Yes.
and then you immediately go work at Air Zermatt, you're already having a big altitude change, and then you're on the helicopter and you're doing, well, you said 3,400 meters is the high end of what you're
No,
doing.
we go much higher.
Oh, you go much higher. What's the highest that you go?
It's about 4.5, 4.6. The Monte Rosa at the moment. The Matterhorn is 4.478. Please remind this number everywhere. Every time I have a conference, I give you get the Toblerone if you know the right altitude.
Yeah. So how many calls are you getting in a 24-hour shift?
Yeah, it depends. Most the calls in the winter time are mostly shorter because we have the ski patrols. They already do a pretty good first aid treatment on the patient, and it's cold, so you cannot actually you can do, but I mean, you plastic on plastic when it's cold doesn't fit really well anymore. So mostly we treat the patients in the helicopter. So being fast and efficient is our highest priority for the best treatment for the patient. So we are working faster than usual because due to the environment, that makes us effective, and we have more cases to treat. So such a high volume for rescues in the wintertime that you have to be fast as well.
So what treatments are you doing on the helicopter as you descend?
Basically, everything that you can do outside, we can do inside as well.
So there's enough room to intubate or do a finger sweep of a chest injury.
Yeah, we can do. I mean, in the modern helicopter do we have? I mean, you have a certain amount of place, and the most common goal is the training. So whenever you have a really well trained crew on board, you can do an in-flight RSI, you can do a in-flight chest train. You can treat the patient whatever is needed inside the helicopter as well. It's not 360 as accessible, but at least you have 180, and the rest you can improvise.
That's pretty impressive.
And this should be also safe for the crew as well, depending on the conditions, on the flight or the wind conditions. Maybe you have to postpone it for a while, but so that the pilots make the difference in this case.
That's pretty impressive. I worked on the Hungarian HEMS where they use the Eurocopter, the 134s, and there wasn't a lot of room to maneuver. There wasn't the space on those helicopters to you could probably do some intubation, but you couldn't really get, like you say, 180-degree access to the casualty. So your helicopters are bigger.
Yes, we actually operate the Bell 429, and we made our setup and our training like that we have access to the head. We can, with the stretcher, we can elevate the head a little bit for 30 degrees, so it makes it easier with the CMAC. What's standard for us? Get the tube in, and finally you have access for the patient as well to doing the ultrasound for making the EFAST.
Nice. That really does make a difference, and having ultrasound is profoundly beneficial. How many doctors and medics work at Air Zermatt?
Yeah, it's about between 15 and 16 paramedics full time, and about 30 to 35 doctors. I'm not current with the doctors at the moment. They work part time.
And is there cross training with London Air Ambulance or other places? Are there some collateral collaborations you have?
Yeah, we work really close together with Air Glacier. I mean, in the meanwhile, at the same company. On the other hand, we have the Italian rescue service. We work together pretty good. I mean, half of the Matterhorn is Italian side. Whenever the weather is bad from their side, so we launch the helicopter, and same when it's different. Mostly it's better weather with us. Haha. Otherwise, on our other border from the Alps, we have Rega that we work together, and also if we have mass casualty in the mountains, but we have pretty often passed. So we have a good relationship, and we are managed to get with good conditions, 5, 6 helicopters in 45 minutes an hour together.
So, do you go to a different hospital depending on the language of the casualty? As you have Italian, you have French, and you have Swiss, German. Does it matter where you go as far as what type of patient you have?
Yes, as long they speak and we figure out which language they speak, we can offer them. I mean, normally we go to the next closest hospital that's appropriate for the injury or sickness they have. So for on our side, it's hospital in Visp. If we have Italian guests that's skiing in Switzerland and they really like to go back to Val d'Aosta, we bring them to Aosta. They are already back home, close to their family. Otherwise, if we
Hmm.
have a longer distance to serious cases, we can decide to go to Sion, French-speaking hospital. It's a state hospital, trauma center. If we have more complicated ones, we still are able to, depends on the weather condition always, to have 45 minutes until we reach a university hospital in Lausanne, or a little bit shorter distance, it will be the university hospital in Bern. One is French speaking, one is German speaking. And if you have the chance, weather conditions are good, uh, we can decide which hospital we're going to bring the patient to.
That's interesting. I haven't heard of any other organization that has that much flexibility or that much of a change of where you're going to take the patient, depending on the language that the patient speaks.
Yeah, pretty much really close, a tiny country. So in about one hour, we flew over the whole country by the helicopter. It takes a little bit longer by bicycle, but not, yeah, 2 3 days, and you reach the other side of the country.
Yeah, I've been to one end to the other of the country, and riding with a bike would not be an easy option by any means. So, Patrick, you also have a master's degree in mountain medicine. You got it from Italy. Tell us about that experience.
Yes, a common friend we have, Luigi, set up a master program a couple of years ago with the university in Subria di Varese. One part of them is also with Air Zermatt and Air Glacier. So as Luigi was in Zermatt, he asked us, "Hey, you have the degree. Are you willing or able to join the master's program?" So we joined. We signed up for this great master program. It was 2017. What's about the Masters in Mountain Emergency Medicine? We haven't seen the university so much because we were so busy to travel around the world, meet the experts in their home bases, and learn from them. It was a really great experience. For me, prevention is a big thing in my career. So we were able to see how Denali Mountain Search and Rescue in the national park working. They have really a big study or doing big research about prevention. On the other hand, as well as sustainable mountaineering. And if you have been in Denali, you know whatever you poo, it has to go in a bucket. Otherwise you don't reach the top of the mountains. After that, you're coming back
Mm.
to our mountains. It's not the same anymore. We made all the way to New Mexico, joined Jason Williams with his university, spent some time at the Grand Canyon. And of course, when you are able to walk down the Grand Canyon on the way, you have the teaching of the mountain. It's not. Is it mountain rescue or it's not? it's mountain rescue, or it's
Canyon rescue, maybe. Yeah.
their canyon rescue system. It's a huge difference. You can learn from the guys that doing day by day, one by one. You feel the temperature. You see how you see and feel how hypothermia looks like.
So that's one end of this extreme to the other. You've seen New Mexico with the heat and the Grand Canyon, and then you've seen my home state of Alaska, where you see in Denali, and you probably flew right over Juneau, where I'm from, in the southeast. So you've gotten to see some pretty amazing parts of the U.S.
We had really, yeah, we were really lucky. I mean, climbing in the Sandies, going to Grand Canyon for doing rope extraction, pulling the stretcher from some deep holes up. On the other hand, you go to the coldest mountain on the world, Mount Denali. Yeah, it was impressive. Good lesson learned. Really good. The rest, many lessons learned from my side. I never have done it without this experience. Of course, you can do it. You can do Denali by yourself, but to having actually the people that did rescues for ages there, uh, you learn from their failures, their lesson learned, and for me personally was a good, really super experience.
That's a pretty amazing master's degree. If that took you all over the place and got you to meet these people and see the parts of the world where medicine is in the cutting edge, isn't it?
Yeah, and for me, PowerPoint is like a gray banner. So except of watching Jason Williams is doing a presentation and just showing pictures from the Grand Canyon or from the Sandies, you're actually there and doing rescues with him.
It's quite an experience to go to the bottom of the Grand Canyon and up at the top of the edge it can be bloody hot, and you get further down and surprisingly it can be cold, and you can have frostbite even though it's a desert.
Absolutely true. Yes, and for a rescuer like most of us, you cannot blame the weather conditions, right? To stop a rescue. Also, you can blame the bad weather conditions,
Mm.
but it's cold and warm. It's not something that you can blame on.
So now that you have your master's degree, have you thought about a doctorate?
I took my time off now on the boat and to think about what's the next step, and the next step will be the doctors. That's true, but still struggling to which direction I will heading to.
So what are you thinking as far as what type of doctorate you're going to take?
Good question, Aebhric. Maybe you can support me, support me in this way.
Well, we haven't created a doctorate in mountain medicine yet, but maybe that would be a good option.
We can do that. There are many mountains, not much in Malta, but all over other places.
Other places. Malta has a huge mountain of 300 meters.
It's not about the altitude or size, it's mostly about the technique, right?
It is, and surprisingly, the rescue guys in Malta get called out to those cliffs quite a bit because the Egypts come in and they're like, "Oh, it's 300 meters, it'll be grand." No, it's actually quite dangerous. So the emergency nurses of Malta respond and pull out Egypts all the time that think they can climb 300 meters.
That's true. 20 meter or 1,000 meters, it's pretty it's painful. You can hurt yourself from both altitudes.
Patrick, you are working on a boat. You're an offshore medic at the moment. Tell us about that and your experiences.
Hey, I know what you want to point. So I used a field guide already several times.
Nice. So what did you use it for? Tell us about that case.
Actually, I'm still on the boat. I cannot really talk about this case, but I had the lead symptom of headache. Headache, it's pretty common on the boat. Heat stroke,
Mm.
working a lot for a long time. After one day, still headache. So heat stroke, I sorted this one out. But further on, then came better. We under painkillers, 2 3 days was
Mm.
better. Then it got worse. So after that time, I looked at the field guide. Tried to match what's called fit and not fit. It was super helpful and finally got me to make the right decision on the right time.
I'm always delighted to hear that. And there's always room for improvement, but it's great to know that it made a difference.
Especially also for me, it makes a difference. I mean, you have protocols all over, but how many years of experience are in this guideline? Do you have about expected numbers of years?
That's a good question. So the two main authors are myself and Jason Jarvis. I started my EMT in 1988, so that's 35 years of experience. Jason started as a 18 Delta in 1996, so that's 25 years of experience. But then we have to include Dr. Winston DeMello. He's put in a lot. Dr. Grech, both of those are founders of the college, have a tremendous amount of influence. So 70 years maybe of experience between all of us.
That's impressive and so streamlined. I really, yeah, so streamlined, and most of the cases fits on one page, and that's all you need as a med. All you need the practical skills as well, but that's all you need on one page. Thanks a lot for this one.
It's great that you mentioned that because we have just printed a reprint of the second edition, and the boss John Clark will be putting that on the storefront so people can start buying the physical copy again, which we haven't had since COVID, but now it's back up.
Even everything fits on one page. With my 40 years old in the night, with a small headlamp, I can read it. So it's really practical and handy.
I think one thing I looked at was the Special Forces Handbook, which is you have to be 23 years of age with eyesight of a 23-year-old to read it, and it's just a wall of text and it's in .5 font, and I just couldn't. I'm pushing 60. I just couldn't read it. So that's one reason we created the Quorum Field Guide to be a bit more having more pictures in it and having readable text.
And once I went for a run, put myself a little bit under stress, and try after in the dark, put my head torch on. I was still able to read it, so it works under pressure as well.
So we are going to improve that and put out the third edition, hopefully in late 2024.
Good.
So Patrick, you teach our austere emergency care course, the prolonged field care course that Dr. Sean Keenan created, and you were part of the first course we ran in Norway. Tell us about that experience and how did you like teaching it and how did you like Norway?
I saw that you run the second course in Norway in summer. I prefer to run the course in the wintertime in Norway. So the setting around, I don't think it's always you can adapt, but you have all the things you need for running this course. The support was great. Having John Keenan teaching us what's behind the scene of AEC, how they came up with it, what's their thoughts, and if you can start to teach on the same page like they did, super course. It was a big eye opener for me again. So whenever you have a training and you're doing some scenarios, always use live patients. The same I saw I had with Tim in Malta as well. So for me, it's eye opener. So don't do any practical scenarios for traumas without professional victims.
I agree. We have Laura Bella Vella, who is a he has a master's degree from Hollywood, and she worked on World War Z and Gladiator and lots of other films where there's lots of red stuff. And we're lucky to have her in Malta, where she makes up our casualties.
I saw it. It was impressive. Really, they came and put the patients all over the field. The students, whoa. Yeah, it was a good one, really good. It's super professional, and for me in 2023, you should have the capability to have professional victims that know how to play, and then you can't blame the scenario anymore. Train as you fight, right?
Absolutely, you got to train as you fight.
And back to Norway, the course was you do all the theoretical part back home. When you come showing up in Norway, it's mostly practical. Do the basics right, you learn the basics again, go over again, and then you have the big scenarios, and can learn and improve so much during the scenarios. And also the mix between professionals and basic life support, and we had physicians, paramedics, nurses all over the world. You talked about the last podcast. Everybody can learn from everyone.
Agreed. So, Patrick, what advice do you have for the listener who's just starting out?
When you're a newbie, want to become whatever in a career for austere environment, feel you have to feel yourself comfortable in this environment. When I joined the ship, as always, if you're the medic, you have to be fit, healthy. Your preparation has to be done before you join. So make yourself comfortable. Go and really do research about it. If you are prepared and the crew is see you as a professional and with a healthy lifestyle, they want to be they respect you. And if they respect you, they come to you and ask you for, it's either smaller injuries or big ones. I think it's really it's a hard but a nice way to learn the environment, the medical stuff. It's coming by itself when you join the program, and then you become a professional in the end.
That's awesome, Patrick.
I joined this boat as a deckhand. So as a deckhand, you start with you're the lowest grade on the boat.
Yeah.
So whenever I clean the boat, I learn every corner. During that clean every corner, I make my thoughts, how to move on a boat, be silent, be fast, be effective, get faster in cleaning, get faster in the thought process. So, and then whenever the catastrophic event happened, I had so many time spent on this boat. I know where I can go with which stretcher, how I can evacuate the patient within this tiny, narrow steep stairs when everything is moving. And it's not an ambulance. You can stop on the side of the highway and put your IV in or start to stitch someone together. So it's always moving. You can't stop moving the boat.
Patrick, it's been great to have you as a guest on our podcast, and your input in medicine is definitely moving things forward. It's a pleasure to see you work and have you on our faculty, and I look forward to seeing what you can do in the future.
Thanks a lot. And I will come back to you for my next step up as a mentor, if you agree.
Agreed. Not a problem. Thanks, Patrick.
Thank you.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.